What's going on, everybody? How's everybody liking my new do? I hate it. I hate it. It's the first time I've had hair of any significance. Like, I can grab my hair. First time since 2002-ish time frame. So yeah, I'm doing it for solidarity with my buddies that own my friends that own a barber shop. So I think I may have one more day in me, because Lauren took a picture of the back of my head and the horseshoe. So I got, right, I call it OMH, old man hair, but it goes all the way down to like mid back of my head. It's horrible. So I never saw the back of my head before until just now, and it's embarrassing. So anyways, that's not the point of this conversation. The video today is, obviously today there was a big march protest in Harrisburg, protesting the governor's decisions or indecisions, depending on what side you're on, of opening up the economy on some level. So I wanted to give my 2 cents. So I put a post out earlier, I guess last night maybe, that I wrote a plan up. So I do those things because I like to work through problems. I like to think about different ways to solve problems, and the economy is a big problem. Not having a job for a very large portion of our state and the country, for that matter, is a problem. And it's tough to make that decision. I get that. I have friends that are in the legislature. I don't know the governor, but I'm sure his job is difficult. It's hard to be the one that it has all the people that are scared telling you to not do something, and all the people that are scared of not being able to come back from being out of work, and the long-term ramifications of that. It's hard to figure out what side of the fence or where to put the most attention. But doing nothing is not a sustainable option. I said from the very beginning, the third week of April was kind of when I thought things were going to shift, which is where we're at now. Things are in the process of having some level of a shift. So I'm very happy that I was kind of on point with that. And the reason why I think that is because I know knowing human behavior and understanding what causes stress and what gets people to do things, I knew that was about the length of time that the common average citizen was going to be able to participate in an exercise of stay home because the greater good says so. At some point in time, people are going to stop having those thoughts, and they want their life to get back to normal. And and one of the things that I think that could have made this a little bit easier is if we knew the validity of the number of cases. There's a lot of conflicting information out there, and no one's ever once really addressed it from an official capacity. There's a lot of articles out there and accusations of the death numbers being padded. And by padded, I mean if somebody with terminal cancer who was on hospice dies, and they were dying, but then contracted COVID-19, and that was a contributing factor, but the reality was they were in the process of dying, that person gets put into a COVID-19 death statistic. And that's kind of disingenuous for me. You lose me then, because then we start blending and meshing terminology, and it almost feels like they're trying to pull the wool over our eyes. And I'm trying to be as objective as possible. But when I see stuff like that, and then I hear Dr. Brick stating that anybody that dies who has COVID-19 gets put into the COVID-19 statistics, then I do have some issue with that. I just find it very disingenuous, and it's not telling the full picture. It's giving you a very narrow negative focus, when in reality that picture is pretty broad. So trying to sift through all that and understanding the human nature and the reaction of isolation, and people that are afraid to go outside or afraid to touch anything or to walk by anybody, and all that is real and genuine in people's lives. I get that. So I know that it's a very difficult decision to decide when is time to then start returning to a process of normalcy, because a lot of people don't want that because they're afraid that normalcy will make this thing turn into Armageddon. And my personal belief, based solely on looking at the world and how other places have handled this, what their numbers look like in relation to ours, and then our situation specifically, I'm very confident that we're going into a phase where we can start to see some positive outcomes from this. When this first started, you hear the term virus and you think flu. It's seasonal, right? That's what everybody thinks. I honestly don't believe that this is of the same ilk as the flu. I don't think this is a seasonal virus. I think this is a 24/7, 365 virus. Whether it's as deadly or as life-altering as it potentially could be, I don't think it is. And that's just my opinion. Just based on the last, call it 3 months of trajectory and where we're at now and the demographics of who's most impacted by this, we can't continue. If this is a 365 virus where it's always going to be around and heat doesn't get rid of it and the season change doesn't get rid of it or whatever, then we have to find another plan, because the plan of staying home forever is not a plan. That's an emergency action. That's not a plan. So for me, you have to come up with a plan. And a plan for me looks at the entire process and the entire problem, and you section off the United States. The United States is a gigantic country, and we have 75% of it that's really not being impacted by it. And whether that's because everybody's at home or because travel is reduced or because population density is there's probably all these reasons why. But for me, you have to find a way out, because you can't huddle and hide as a plan. That's just not going to work. The negative outcomes of that, of domestic violence, of child abuse, of poverty. Poverty can do a number on your personal life and then cause you to make bad decisions. Drugs and alcohol and suicide and all those things that are coming from this, that if this sustains longer, if this continues another 4 weeks, those numbers are going to be ridiculous. As a cop, I can tell you people are already getting shitty, just in general. You have and it's starting to become this divide where you have the world is going to end, please don't come near me, and I'm walking out like a hazmat suit. And then you have the people that are like, fuck this, let's go back to work. I don't care, I need to make money. And it's becoming a much bigger population in each one of those categories. So I can see this getting shitty real fast. And then when you start having protests, and the protests are a byproduct of people who are shitty. Just so we're on, this isn't the people that are out there today probably have a political agenda because they believe in one side or the other, or they're pro Trump or an anti-wolf, whatever. The reality is that this is the beginning of shitty. And I predicted this from the beginning, and I know, if I know anything, I know what causes people to act poorly and to make bad decisions. And unless we're willing to make some exceptions and make accept some cold hard facts, then we're just going to be stuck in our house and people are just going to get shitty and it's going to turn into pandemonium. And I want to stop that more than anything, because I don't want to have to make a decision in my role as a cop that is based on things that I didn't create and the person that's doing it didn't create. And it's very difficult to feel any level of loyalty to my government when they're the ones causing this. So I came up with a plan, and it's not comprehensive. It's not the be all and end all plan, but I started to look at it and said, okay, what would I do? So we have to look at the state as a whole, from like a macro point of view. And there's 67 counties in Pennsylvania, and there's only 11 counties out of the whole 67 that have more than 500 reported cases. And those are the obvious ones, the Philadelphia in the suburbs, and then Pittsburgh in the suburbs, and then some a little bit up more towards like Scranton, Wilkes-Barre area. So that's pretty much the hotbed. So I look and I go, okay, well, let's make some assessments. The counties that have less than 500 cases can begin a process of rolling back to work. The ones that have 500 plus cases, we're going to have a staggered starting point. So you got to have the healthy area first, and you got to look at how does that rollout start, and what are the ramifications. You can truly see spikes in the healthy areas much clearer than you can see the spikes in the hotbed areas, because they're already hot, they're already agitated, and the water's tumultuous. But in the calm areas, the minute you allow them to go back to work, you're going to see whether or not there's going to be a spike, whether that return to work changes the what's happening in that county. And I think that's a very smart approach, is to start a rollback plan, which is not drastically, it's not like you turn the light switch on, like they say, and I hate using the same terms as everybody else. I hate that. You can't just start and go back to normal. You have to roll this thing back. And I said from the very beginning that there would be a reverse rollback. Essentially, the first thing that happened was the ban to China. That's going to be the last thing that gets lifted. So in that kind of vein. So what I wanted to do was start, first of all, defining how to be healthy. Like there's never, and I said this to my state rep, I said, listen, I have yet to read anything anywhere that explains to the common person who is doing it wrong how to wear a mask and how to keep that mask as useful as possible. How to wear gloves. What can you and can you not touch while wearing gloves before having to change your gloves? Like all that kind of stuff needs to be explained, and it needs to be explained not in a way dropping F-bombs like I did and calling people idiots, but in a more professional, political way. So that's number one. Understanding what is a protective piece of equipment versus a barrier, because that's really the difference. Social distancing needs to remain as much as possible. We need to understand the impact of how many people together at once, and what does that look like moving. Like if everybody got together, if 10 people get together, how many people potentially could be infected if someone in that group is infected, and sort of manage it based on that. So social distancing has to maintain, and everything has a variable attached to it. So if for 2 weeks we roll this thing out, we start moving the ball out, and people can start coming back to work, you're going to start to see the goal of that is to see what is the initial impact of those 2 weeks. Because you're going to see, because it's 14-day potential gestation period for the virus, you're going to see some things start to present themselves during that period of time. That's why you go to the safe spots first, the ones that have the least amount of virus penetration, because you'll see the change more dramatically there. Hygiene, just giving simple, how to wash your hands. I know that's been out there before, but people need to understand that your clothes, if I sit on a public transportation seat and someone was infected that didn't wash their clothes and it coughed all over themselves, or somebody coughed all over them, that seat has the virus on it potentially. So just understanding, how often should you change clothes? If you are that worried about the virus, then maybe change outside and then quickly put them in a bag and throw them in the wash. Like there's mitigating things you can do. And that's where this gets, the reason why I get so pissed off about the mask is because it's not as simple as just putting on a mask. Mitigation is not a simple process. It's an in-depth, deep, you got to really think all day, every day. If you're really concerned about the virus entering your body and then you giving it to somebody else, then you need to come up with, the government needs to come up with guidelines that people ingest and they process it and they go in and act upon it. That's the only way those things actually truly do work. So here was and this is just, I'm going to give you the 30,000 foot overview. I want to start this on, if it were me, if I were the governor, we'd start on May 1st. He just extended it till May 8th, so I guess we're not starting on May 1st. If you didn't hear that, breaking news. So anywhere in the 56 counties that are not hotbed areas in Pennsylvania, they start first. So basically all places of worship reopen with a 50% capacity maximum. So you're only allowed to have 50% of your potential population of your churchgoers go, and you have to have social distancing and the seating and stuff like that. And you will, in order to get everybody to church, you just add additional services to your daily setup for church. If for 1 month, we're able to keep in those not hotbed areas within a plus or minus 1%, maybe 2% deviation on number of cases, then things are working. That's kind of where I see it, because everything's under 500, 1 or 2%. You kind of figure it's like 5 or 10 new cases over the course of each week, and then keeping them on. And we have to start, and that's one other thing. We haven't been tracking, they're not tracking people that have recovered. So we have to create a category of presumptive. If we can put people in the list of deaths for COVID-19 as presumptive COVID-19 as the reason why they died, we can put presumptive COVID-19 as the way that they are no longer sick. So if we know the number of tests positive, we know the number of deaths, if they're not in the hospital, we're going to put them in the you're not sick anymore category. So we have to start doing that. So 1 month is kind of like the we can really see what's happening in 1 month. I keep getting messages here. Barry says, yes, Barry, I know you like, I'm cussing more in the other one. And I'm trying to be a little bit more professional here since I'm putting out a plan. Essential businesses, the ones that are currently essential, they get to go back to a more normal setup. And those could be restaurants, anything that's currently essential that's maybe working on a skeleton type situation, like a restaurant's doing takeout only. There's going to be changes that allow them to re-engage their business in its normal way, from going from the essential skeleton crew kind of business operation to a more, not full, but a more traditional way of doing their business. And that would be outlined with all the guidelines, depending on the type of business and all that kind of stuff. Parks, lakes, golf courses, those would be reopened, because if we're going to be outside, I believe outdoor activity is good. And as long as we're maintaining social distancing and we're not, doing 10 to 15 people gathered together, then I think that's a safe thing to do. And I think it will give people a chance to feel normal again if they can get outside without having to worry about, and I saw, I don't know if it's in Maryland or Michigan, one of them where you could get in a canoe, but you can't get in a motorboat. It was very weird. I know why they did that, because you can fit more people in a motorboat. But I think that doing that creates the sense of the valve being released a little bit and people having a chance to go out in the parks. Public transportation, 50% capacity. And I think they're doing that now, or at least on some level. Have the same amount of get back to a normal operation schedule, but only allowing 50% capacity on the bus. And bus drivers would be responsible for that. It's just like they wouldn't stop for a bus stop or a subway stop if they're full. And they just changed the switch on their light, saying that they're of capacity. So I think that's a pretty simple one. All right, so non-essential businesses. So, and I think they start, this is all happening at the same time. So the things I just outlined start right away, and then non-essential businesses begin to come back. I kind of broke it down. I was thinking in my head, what's the majority of small businesses, right? They're not 60,000 square foot facilities. They're mostly, 1,500 to 3,000 square feet shops. So I went with the higher end. So basically restaurants that were not in the essential restaurants can come back with, as long as they have less than 15 employees and under 3,000 square feet of interior space. And then also there would be, and that includes realtors and landscapers, construction, car dealers, things of that nature. But they have limited employee allowance. So under 15 employees, but they got to be staggered. They can't all be working at the same time, that kind of stuff. If you can kind of understand my drift. If you have any questions, if that doesn't make sense, just put something in the comments and I'll try to clear that up. Restaurants would be, to start, they would be allowed to have eat-in dining, but there would have to be disposable everything and that kind of stuff. There's a lot of, in order to keep sanitation at its highest, there's some things that they would have to adjust to, which I don't think would be crazy expensive, but I'm sure there would be some level of government assistance to help offset some of that because they're mandating what you can and can't do. And everything is based on a 1 month projection. And after 2 weeks, you make an assessment, but you're hoping for a month to be able to roll this thing out and really truly see how things are going. With the sit down restaurants, they would have to have either only takeout and then people can come in and get a reservation. So even at pizza shops and stuff, they would just have to take reservations so they can control the environment. Having people waiting outside in line and all that kind of stuff just to me doesn't do what it's intended to do. So reservations for interior seating for the first month with a 50% capacity is really, I think, the best way to allow them to ramp back up their numbers so they can start to make additional revenue and waiters and waitresses can start coming in and getting paid and getting their tips and all that kind of stuff. But it would just be on a, depending on the size of the number of seats, they would be able to 50% capacity, social distancing on the spacing of the seats, and they would do it by reservations. So that's after 1 month. Businesses with less than 15 employees, any type of business, it doesn't really matter. But they couldn't have 15 people all working at once unless they had social distancing set up and they didn't have, not every business has everybody interacting with each other. So if you have one of those kinds of businesses, you would have to apply for some sort of a permit that says, yes, this is the kind of business I run and that's how I would do it. Reading here. Businesses with under 3,000 square feet, same thing, at any given time, no more than 15 people in the building. So that includes your staff. So you would just have to, if you're a paint store, you would just have to have someone there making sure that you're no more than 15 people at one time inside the building, and that obviously social distancing. And let me back up. I do not believe mandating masks is the right decision. I believe that people who are logical adults who understand their own health and understand where they are, and I get it, you could be asymptomatic, and that's going to be forever. Just so we're all on the same page. That's not changing. Even if you get a vaccine, that's not changing. You're not going to be cured. This isn't, it's not a cure. A vaccine is a preventative measure. The flu vaccine doesn't cure the flu. It just means you have a better chance of not getting too sick if you have the flu. So it's not a cure. We have to really be clear on that because we're not going to get a cure to the coronavirus. It's just not happening. So we have to figure out how do we live knowing that someone may have that virus and hope that the highest risk population is not exposed. So I'm going to skip around here a little bit. The highest risk population are the elderly, people that are in hospitals, people have immune deficiencies. You know who you are. It's not a surprise. At least 95% of you know who you are. We know who our family members are that fit those bills. It is our job to be as cognizant of that and make the proper adaptations into our interactions with them so that we mitigate that risk for them. I, Matt Cubbler, am not in that high risk category. I don't have a fear. If I get sick, I get sick. I get that. I don't have additional complications that would create I might die environment. I know there's anomalies. I get that. But we can't work off of a all or nothing mentality. We have to start to segment this out. It's like war. It's like a battle plan. And I'll talk about what I think is actually happening right now with all these Javits centers and all that stuff going up because I do have an opinion on that. But so let me just get back to what I'm talking about here. So that's like the first wave of everything opening up. You have the the parks and churches and all those things start to happen. Essential businesses can start to ramp up a little bit more than what they are, and then the non-essential businesses that fit into certain categories can begin that first phase. The next phase is that after 2 weeks, so we're going to do 2-week measurables. If there isn't a change of plus or minus 1 or 2% in the total cases, then we continue to move forward into the expansion of all the things I just talked about. We increase the capability. So instead of 50%, we go to 60% or 70% of church attendees, and increase the number of people in a 3,000 square foot facility, and how many people can a restaurant seat every hour. That kind of stuff is what we start to adapt if there isn't a dramatic change in the plus or minus 2%. To get the 11 counties that are at in the hotbed, before they can do anything, there has to come up with a way of tracking total number of recovered. Like I said, we have to put the ones that aren't dead and aren't just diagnosed have to have an outcome. We have to presume that if they didn't go into the hospital, then they're okay after 14 days. So what I want to see is what are the number, if we create those categories in the hot zones, what does the number, initial criteria was more than 500 cases diagnosed is what I set at. Of those 500 cases, subtract the number of deaths in that county and the number of recovered. Are we still in a hot zone area with those counties? And we would have to look at each county individually. You can't just then go all 11, open up the doors and let it go, because most of those are commuter areas. So people that that live in the suburbs go to work in the city, and people that work in the city, I don't know why they would, but they may work in the suburbs. So we have to look at that from an individual county basis. Number one. So if we can get that number to below 500 for the 9 counties, which are the suburban counties, under 500, and under 1,500 for the cities, Philadelphia and Pittsburgh especially, then I think we can start to actually begin to do the phases that I just talked about in those areas. Colleges, schools, like summertime activities, tours, summer camps, all that kind of stuff begin. I think we can start them safely June 1st if what we're seeing in the business expansion as far as people going back to work, if we're not seeing a gigantic spike. There's a lot of things that are going to be decided based on that. So I do believe that if we start June 1st having the ability to have these camps, the ability to have tours, but have them where there's obviously on the tour level, there's only so many tours going on at any one time in the campus, hygiene stuff all has to be, and with all this, having wiping things down, proper hygiene, all those kind of things have to happen at each one of these facilities, especially during the ramp up. Sporting events. I think we need to have sporting events again, but I do believe that we need to have them with no fans to start, because you can't go from zero to filling. So we have to start somewhere. And I think especially on the pro level, that needs to happen, just for our own mentality. I think that's if we're allowing people to go back to work, they should be allowed to go back to work as well. Like the camps and all that kind of stuff, as long as they limit the number of participants and that there's enough separation, like coaches per group, to have those camps, then I think they should be allowed to have those camps. Kids are the least likely to get severe symptoms from this. Obviously, there are anomalies, I know that. But as a whole, kids are the least likely. And then I think when it comes to hospital visits, the elderly care facilities, all that kind of stuff, we need to be overly cautious. The way we've been needs to remain in that world until we get this whole thing figured out on how to best protect them. And, but I do believe in it. I've read a lot of stories on people that weren't able to, and people that I'm friends with, that weren't able to see their loved one as they were dying. And to me, that's heartbreaking. And I think there has to be an exception to every rule, and there has to be waivers signed, and there has to be equipment on hand. So if, God forbid, anything happened to a family member of mine and they were in a hospital and they were about to pass on, that I would have the ability to put on some protective gear so that I'm not spreading or contracting anything, and be with my family member. That has to be accommodated. There has to be a way to do that. So for me, that's a gigantic piece to this puzzle, because people are dying. It's not the 1918 Spanish flu, but it's bad enough to where it's caused an entire planet to pretty much shut down. So that was just some of the thoughts I had. I sent it to a few legislators who I know, if nothing else, just to maybe spurn some ideas in their head. If anybody has a question they want to ask me, I'd be more than happy to answer it. Let me see if I can pull up my page here and do this simultaneously. Can't read them all. Anyways, so if anybody has any questions, just ask. I do have an idea as to what's happening. So if you think about, there's like 10 things happening at once here with our government. Some are a reaction to the virus itself, the actual virus itself. Some are, I believe, overreactions to the virus itself. And then I believe there's some things that are happening that are more helping people to, not people, but the country to be prepared for the next pandemic. I believe the Javits Center stuff, all the mercy and the comfort and where they're building all these, turning hotels into hospitals and event centers into hospitals. Some of those, like in New York, I think were intentional to potentially help with overflow. But in everywhere else, I believe they're simply coming up with a blueprint that when I was in the military and even in SWAT, we do scenario training, and we try to make it as real as possible. I believe with what's happening now, this was a prime opportunity for our government to get their shit together. I said it from the very beginning, to figure out if this were to happen again, and it was the big one. I feel like Fred Sanford. Elizabeth, the big one. For those of you that remember Sanford and Son. I think that's what's happening. I think a lot of the ones, and you'll see they're built and then they tore them down. No one ever used them. They knew that. They're not dumb enough to simply build something in hopes that it gets, or thinking it's going to get as bad as it might, and then tear it down. They're taking different building structures, different places, and creating basically a database of how-to designs so that if in case this ever is so bad that we need to build hospitals in 3 days, they can do it. There's a process. It wasn't done before. This is all happening on the fly. It's like a real-time war games exercise, in addition to all the stuff they're doing to actually handle the spread of the disease and some of the stuff they're doing, which is an overreaction to disease. And the president allowing the governors to handle their own states was strategic, because some governors are more in line with the way I think, and some are completely off the wall, like the one in Michigan who's doing all kinds of crazy stuff. And I believe Tom Wolf is pretty close to her as far as his the way he thinks. And so I think this was all, there's a lot of things that were happening that all at the same time. And not to mention there's probably some political underhanded stuff happening, and I'm not going to get into a politics thing, but I know if I were an opponent of the president, I sure as shit would be using this as a way to ensure that he doesn't get reelected. That's what I would do. And this isn't, if anybody starts putting politics stuff on here, I'll delete it. But these are all happening. Everything is happening at the same time. Yes, Bobby, just like the Glen Mills School being changed over, that it got used by like 10 people because they had to see how it worked. But it wasn't because there was an overwhelming need. It was part of this process of planning and taking the opportunity to, I guess, seize the moment, for lack of a better term, during a crisis. And how would we handle it in real time during an actual crisis? And I think a lot can be learned from that. I don't begrudge the government for being smart enough to take advantage of an opportunity to learn and grow and become better. So for that, I'm very thankful. I'm glad that they did it. But I was very clear from the very start that only one I ever thought that was ever going to be used was in New York. And I think I'm pretty much right. There might have been a couple people here and there in a couple places. There were a few people in the Comfort and the Mercy, but for the most part, it wasn't due to overflow. It was just due to seeing how it would work. So that's my 2 cents on that. The masks. I will finish up with that. I don't begrudge anybody for wearing a mask. I just want you to do it right. And if you're going to do it right, figure it out. Do it the proper way. I went to CVS yesterday to pick up a prescription. The lady at the pharmacy was in the pharmacy. I was getting my stuff. She followed me out, got to my car. She pulled her mask down. She had her gloves on. She lit a cigarette, smoked a cigarette, put the mask back on, went back to work. And I went back in just to see, and she didn't change her gloves. She touched stuff on her way in and out. So people just aren't, they're thinking the gloves and the mask protect them, and they don't. If nothing else, it just makes someone else feel better. And I guess there's a value to that, but it's certainly not medicinal, that value. It's not helping you physically. It may help you emotionally, may make you feel better. You may look at someone who's at the store not wearing a mask and think, that selfish prick. But if you go and touch your mouth and lick your fingers to get your credit card out, then you're an idiot. So there's two sides to every story. You don't have to be all in on either one side to do this right. You can be empathetic to the people who are truly afraid. You can be sympathetic to the people who are suffering. And you can be sympathetic to the people who are suffering physically, from the virus. And then you can be sympathetic to the people who literally are losing everything and probably will not have a very good mindset, and potentially could be suicidal or could be hurting someone else as a result of it. You have to find a way to do that. And that takes logic and a lot of people moving the ball in the same direction. And I'm hoping that my legislators that I have influence meaning that they're my friends, that I can convince them to do the smart and logical thing, not the politically motivated thing. And that's where this can all blow apart, is when politics become the deciding factor in yours and my life. That's when shit goes sideways. And that's when, at some point in time, people are going to get the shits of this. And not just the fringe people, but the normal, everyday people like us who just want to get back to some level of normalcy, but are willing to bend on either side to make it happen. At some point in time, they're going to snap. And they're going to be like, fuck this. And you're going to see stupid shit happen. And that's what I'm trying to avoid. So I appreciate everybody that hung on. It was a long one, I know. But I wanted to, I put out stuff all the time. I did this, I did that, I wrote this, I wrote that. I wanted to give you an idea of what I did. It's actually 7 pages long, but I gave you the highlight version. So that's it. That's all I got. If you have questions, if you want to put comments in that are helpful, not divisive, then please do so. If you put in something about politics, I'll delete it. And it's not personal. I just don't need the nonsense on my page. All right, guys. God bless. Take care. God bless America.